Hello, everyone, and welcome to Cross Country Conversations hosted by Pharmacists Without Borders. Today, we will be getting into a very hot topic in the news right now, which is racial disparities. We will be diving into how racial disparities within the healthcare system, how it affects pharmacy specifically. So we are very excited to have Dr. Stephanie Young-Moss, who is a graduate of the Xavier University of Louisiana, and also holds a master's in health service administration from the University of Wyoming. So for nearly 2 decades, Dr. Stephanie has served on various boards and volunteer organizations that focus on health equity, decreasing implicit bias, addressing social determinants of health, and also empowering communities to advocate for their health. So she has also served on many boards for the Minority Health Coalition and the Marian and Azenkazi, sorry if I said that wrong.
Ashkenazi, it's okay, it's
Ashkenazi Health Center, where she is currently the Clinical Quality Committee Chair and Board Secretary. So this webinar will be hosted by myself. So my name is Selina Manji, and it will also be hosted by Lauren Taylor, who is currently the VP of Marketing and Communications. My current position with Pharmacists Without Borders is VP Ontario. And just a bit about my background, I hold a doctorate of pharmacy from the University of Waterloo, and I also completed a master's in global health from McMaster University. So I will now be passing it on to Lauren, who is my co-host for the webinar.
Thank you, Selina, so much for that introduction. So like Selina said, my name is Lauren, and I'm currently the VP for Communication and Marketing for Pharmacists Without Borders Canada. A little bit about me. So I just recently finished my PharmD at the University of Waterloo. I'm a 2020 graduate, and I'll be starting a master's of public health and epidemiology with a collaborative specialization in global health at the University of Toronto next week, actually. So I'm really excited. And I'm also really looking forward to hearing from Dr. Stephanie. I know we had a little bit of an introduction from Selina on your background, Dr. Stephanie, but is there anything else that you wanted to add or information on how you got involved in discussing some of the racial disparities in healthcare?
Yeah, sure. So like you said, I've been a pharmacist for over 2 decades. And when I say that, wow, that sounds like a long, long time. But I've had various experiences within pharmacy. I've worked in community pharmacy, I've worked in managed care, and then I've also worked currently in industry. So I've had a lot of good experience that has let me see different disparities in different ways. And over those 20 years, I've made sure that I have kept in contact with my passion, which would be decreasing healthcare disparities or increasing health equity. So I have done that by volunteering with several organizations over those years. So that's a little bit about me. You guys have done a great job doing the rest, and that's me.
Okay, awesome. So we're just going to dive into it. We do have a bunch of questions to get into, specifically relating to racial disparities. So as Dr. Stephanie, as you know, racial disparities is a huge hot topic in the news lately, but there isn't a lot of talk around how it relates to healthcare. So I just wanted to get your thoughts on what are, first of all, racial disparities, and how exactly does this relate to the pharmacy world?
Okay, well, racial disparities, and you know, the term has been out there for a while, but like you said, it's really just now a very, very big hot topic for the general public. Maybe not so much with those that have been in it, but with the general public, because everything that's going on now with COVID, and then also with some of the injustices that are really being brought to light now. But racial disparities or health disparities as well would be the difference that are preventable when it comes to burden of disease or the ability to achieve optimal health. So if your race is a cause for you not being able to have optimal health, then that would be considered a disparity. Now, a lot of times with healthcare disparities, it could be for a group that is socially disadvantaged, which could be race, gender, age, etc., or socioeconomic status. But for racial disparities in particular, it is about a person's race. So what things are causing them to be disadvantaged because of their race? And it could be typically due to unequal distribution of resources. So for instance, that could be social disadvantage, political, economic, environmental, all of those things play into those disparities. So that's the official definition that I would say, in my opinion, that it is as far as what a racial disparity is.
Perfect. So how would you say that some of these racial disparities are related to healthcare? And
yes,
like, do you have some examples of how it affects the pharmacy world itself?
Mm-hmm. Well, when it comes to pharmacy or even in healthcare in general, a lot of times you'll see racial disparities, and people don't understand that when it comes to these disparities, there's about a $35 billion expenditure for these healthcare disparities each year. So if someone, because of their race, is not getting proper treatment, if they're not taking their drugs the right way, if they're not being able to get a particular drug because of their race, a lot of times that will contribute to how much we're spending per year on extra costs that we're spending on people as well. So some of the examples when it comes to healthcare, if a person is discriminated against for their race because due to disparities, a lot of times you will see things like more amputations. You'll see that a lot of times. You'll also see patients are 40% less likely because of their race to be able to get pain medications. So why is that? It's because is the pharmacy prejudging them before they even come into the pharmacy? Are they looking at them and assuming that they're seeking? Are they making certain assumptions because of their race? So they're not giving them the medication because they don't believe that they're in pain. So those are the types of things that you will see with pharmacies and also healthcare in general. And there are a few other statistics such as African Americans or Blacks in general in the United States, they are 50% more likely to die from breast cancer than other races. So those types of things. And a lot of people will say, well, is it just race? Many times it's not just race. Sometimes it can also be due to, if you add race and you take out a person's college, their college degree as far as when it comes to if they're likely to die during childbirth, Blacks are 5.2% more likely to die during childbirth, regardless of their education. So a lot of people want to point to education and social determinants of health, which we'll talk about, but a lot of times it's not because of that. Sometimes it's just because their race is one of those determining factors as well.
Mm-hmm. Yeah, definitely. And it's really unfortunate to hear some of those statistics because that just really puts things into perspective for us.
Yes.
So how do you feel like this COVID-19 pandemic has highlighted some of the racial disparities that are prevalent around the world?
Well, the disparities have always been there, but I think that the pandemic really did highlight and expose it and make it more seen. And it's even in the news more, so it has highlighted a lot more. COVID is affecting people of color at a higher rate than other races. So when it comes to death, people of color are 2.3 times higher to die from COVID than white Americans. So, I mean, that's a large percentage, especially when you're seeing that in the United States, and I'm using this as an example because that's, of course, where I live, but there's about 13% of Black Americans in the United States, but about 25% of those are dying from COVID. So that's a large disparity there, and people are still wondering, why are we seeing this disparity? And I'll give an example for Chicago. Chicago has 30% of Blacks living in the city. However, their deaths are 57% when it comes to COVID. So a lot of times you'll see that these patients who are contracting COVID, they may be essential workers. They may have to go to work. And when I say essential workers, these are the people that we need that may be working in the hospital. They may be the people who are cleaning the hospitals and taking care and making sure that we have a safe environment to be in. They may have to drive a bus. They may have people that have COVID on there. They may be some of the frontline people that we really, really have to, they wouldn't even realize that are there, that are taking care of things for us to make sure they have a safe environment, but they're working and they don't have the they don't have the luxury of being able to stay home and stay safe. They have to go to work. So those are some of the things that you're seeing. But then also, there was a case in Memphis, Tennessee, that they started to see COVID cases go up. But when they did, they put a lot of the testing centers on a part of town that is a little bit more affluent. It's not very diverse. Instead of putting more of the testing centers in the part of town that needs them. So if you see that, the people are getting tested. They didn't know they had COVID. So therefore, what are they doing? They're spreading it to others in their community as well. So little things like that that people don't think about. So I will say that once Memphis, once they realized that this disparity, that they were testing more in a neighborhood that did not have as many cases, they ended up changing it and reporting what they saw. But just little things like that. As far as your neighborhood, what kind of resources do you have in your neighborhood that is able to, that's able for you to even get a simple COVID test?
Yeah, and it's just like small steps like that. And like just taking those small steps help to prevent that entire domino effect, right?
For sure.
Exactly.
Yeah.
Exactly. I think just making sure that you're mindful of what you're doing, whether it comes to you personally or as a health system or as a pharmacist or as a pharmacy. When I say pharmacy, I mean the actual a corporate pharmacy. What are you doing in those neighborhoods that may be different? How are your pharmacists being trained? How are your pharmacists helping and listening to the people in those communities? Even those little simple things can help change the trajectory or help decrease healthcare disparities as well.
Absolutely, for sure. And I know throughout our conversation, you have discussed those social determinants of health, but just for those viewers watching, so when we look at health, we consider social and economic factors and try to see how those factors influence our patients' accessibility to healthcare. And these group of factors are what are referred as the social determinants of health. So Dr. Stephanie, from your perspective, I know you've given some really great examples already, but what are some like key social determinants of health that you've noticed are contributing to those disparities that we're seeing in healthcare?
Well, when it comes to social determinants of health, you will see things that may affect you as far as the economic or the economy. What type of job do you have? Are you able to get a job to be able to pay for your bills and your basic needs that you have? So economy is one. And then you also have healthcare. You have access to good healthcare? What kind of facilities are in your neighborhood to be able to allow you to get healthcare? Are they some neighborhoods may not have, if you drive through some neighborhoods, you will see nicer hospitals with nicer facilities and all types of resources, but in other neighborhoods, you won't see that. So that's access to good healthcare as well. And then also, what type of job, when it comes to economy and healthcare, putting those two together, what type of job are you working that will even give you a health plan or a health system? I know you guys may not have that problem in Canada, but here, do you even have a job that allows you to have health care? Or can you afford the health care that you're getting? So if you don't have great health care, then you're not going to the doctor and you won't catch things as early. And then also your neighborhood. So people say, well, what type of neighborhood do you live in? But not just your neighborhood. Does your neighborhood have parks? Does it have playgrounds? You don't think about those things when it comes to kids being able to play and play in a safe area. Is it safe? Do you have sidewalks? Do you have grocery stores? Do you have pharmacies? I think we're seeing a lot more what's called pharmacy deserts, where you have a grocery store desert where you don't have grocery stores within miles and miles, but a lot of urban areas and some rural areas as well, I will point to that, they don't have pharmacies that are within an area that people can actually get to. So therefore, they either have to take the bus or have someone take them or spend money to get to the pharmacy to even fill their prescription. So we're starting to see more and more pharmacy deserts as well. And I would predict that we'll probably see more in the future, especially if we have pharmacies that are closing, or if you have pharmacies that are merging as well, you'll start to see more pharmacy deserts. And then also education. So with education comes literacy, language, or people being able to speak the language as well. And then are you able to get higher education with that, be able to have a higher education as well for either high school or college. And then social. So social, a lot of people don't think about social, but discrimination And racism is a public health issue. So that's why it's one of the social determinants of health. So do you have stress? Are you stressed? You know how to deal with stress? And do you have a good support system? That's important as well when it rounds out the social determinants of health.
Yeah, for sure. There's so many different things that we often overlook and don't even think about that are all just, it's like the cumulative effect of all of those.
Exactly. Yep.
Yeah, and it's hard to, when it seems like a bit overwhelming in terms of like, how are we going to fix this problem? But do you have, like, are there any ideas that you have going forward in terms of how we can minimize those barriers and just like improve equity in healthcare?
Well, I think it's important when it comes to pharmacists in general. And well, I'll start with health systems. So when it comes to health systems, you have to make sure that you are training your staff, training the physicians, training the nurses, and the pharmacists that are there, all the healthcare professionals. Make sure that you are giving them cultural competency training. Make sure that they can understand and make sure that they can empathize with their customers. But not only are you training them, but are you also measuring what they're being trained on? So once you get trained, have a yearly or annual testing. Just make sure, hey, are my healthcare professionals still culturally competent? Are they paying attention to and listening to their patients? Is there some bias there? Because there's unconscious bias that people may not even realize that they're doing. Of course, there's overt where people know that they're being racist, but there's some things that we may do that we don't even realize that we're doing. So having that training will help you see that in yourself. Are you treating someone different because of the color of their skin? So I think it's important for us to have people in our healthcare systems that are working in the neighborhoods that look like the people that they're serving. Because when you come in and you see someone that looks like you, not only some studies have shown, it's called social concordance. So if you have someone that looks like you, a lot of times the clinical time will go up. They're spending more time with the patients, and they also feel as though the healthcare professionals are more empathetic with them as well. And that shouldn't be the case, but I mean, it does happen. So some training will actually help with that, but having someone that looks like you when you come into the hospital, that really helps the patient have a better experience as well.
Sure, definitely. That was actually going to be our next question, which is related to, no, that's okay. That's actually amazing, because we were thinking the same thing about having an increased representation of minorities within the healthcare system and seeing how that might help. So as pharmacists, what are some strategies that we can use to help reduce some of these disparities?
Well, I think that listening to, I know I just talked about health system, but as pharmacists, we are one of the most accessible healthcare professions. So when a person comes into a pharmacy, and this is, speaking directly for community pharmacy, but when they come into that pharmacy, they are, they're very accessible to you. So we have to make sure that we're listening to the patients. Make sure that ask them the right types of questions when they come into the pharmacy. Can they afford their medications? And this is just not just with race, but this is just with anyone really. Can they afford their medications? Are they having to choose to pay for food over medicine? So those types of things, listen to those types of cues. And I know that pharmacists are so busy these days. And I'm so grateful that community pharmacists are there and working with patients, and they're busy. But just try and listen, try and ask the right types of questions. Know your customers, and when they come in, know your community. Knowing them and seeing them, a lot of times you'll be able to see certain things that change that you may not have known if you're not listening to those patients, right? Those types of things. And don't be quick to judge, and don't be quick to label when someone comes into the pharmacy. And then also, try and look inside of yourself and see if there's something that you may have done that could have been a bias that you need to recognize and take that out as well. But so those are some of the types of things. But getting back to increasing, and I don't know if you wanted to go this route, but increasing some of the people of color in the medical field in general, that is also helpful, especially with pharmacy, because in the United States for pharmacy, we have about 5% people or 5% of the population for pharmacists are Black. About, I believe, 52% are white, and 25% are Asian, and then the rest is other. So those numbers right there tell you that there's not a lot of diversity within pharmacy. And I actually say 52%, but I think it's more than that. I think it's in the 60s, and I apologize, I can't think at the top of my head, but I think it's in the 60s for white pharmacists. But those numbers right there, when they come into the pharmacy, they're not seeing someone that they know. So we have to do our job as well as pharmacists to give back, to mentor someone that doesn't look like you, to go back into schools, high schools, colleges, to talk to people about your career. And then also go as far as corporate wise, put more people of color in leadership when you're trying to hire someone. Put someone that may have a different perspective than you have to try and bring more diversity into that background. So all those types of things will help trickle down to the pharmacies as well when people are trying to, when the people want to see someone like them or someone that they know.
Absolutely, for sure. I think that's so important. And I think as pharmacists, sometimes we might not feel like there's much we can do, but like you said,
Right.
the front line, like we are one of the most accessible healthcare providers, and being able to like mentor someone or give back in that way, I think is super important to ensure that in the future, we're learning from our past mistakes going forward.
Right. Right. Sometimes we get so busy with our daily lives and so busy with giving out a prescription or making an IV or whatever it is that we don't look up, listen, and want to, or think that we can give back. But there are certain ways that things that we can do as pharmacists to be able to give back that may not even only take, a little time out of our month, but it means a lot to someone else. So volunteering for certain organizations or being a mentor are great ways for us to try and decrease those barriers, because it has shown that pharmacists, that if let's say if a white pharmacist, if they don't have any experience with a person of color, if they mentor someone or if they go out their way to try and get to know someone, that actually helps them professionally to see a different perspective. So those types of things that you may not think that will actually affect you actually are affecting you when you're speaking to someone or reaching out to someone that you don't have a lot in common with. We'll take that back. You may not think you have a lot in common with them until you talk to them. And that's one of the ways that mentoring actually helps as well.
Definitely, absolutely. And then just going forward during this pandemic, can you identify like any next steps that you think would be good for us to take to kind of improve and step away from those racial disparities that have really been highlighted during the pandemic?
Yeah, so of course, like I said, making sure that we have cultural competency training is so important for everyone. And then also looking inside yourself. So there's an acronym that I like to use when I talk to healthcare professionals, is tell them to do it with love. And love stands for listen and learn. That's your L. Make sure that you're listening to your patients and make sure that you're learning from them as well. And your O is to observe and omit. So if you observe something in yourself that may be a bias, an implicit bias that you don't realize, observe that and then take it out and omit it. And then also make sure that you value your patients, because if you value their lives, you will actually treat them differently when you come into contact with them. And also make yourself vulnerable. So when you're talking to the patients, make yourself vulnerable. Talk about your day. Ask them how their day was. You'll be surprised what you find out from them as well. And then also make sure that you educate yourself by reading, by and we use Google so much for everything else. There's a lot of great resources, but look up information and educate yourself on certain trainings, or go out your way to take a certain training that may be out there. There's a lot of free trainings online right now, whether it has to do with racial or health equity or disparities, but you can also read and make sure that you're looking at things that you can read and learn. And then also empathize. Having empathy is so important as healthcare professionals, because we take oaths to help people, but we have to make sure that we have that empathy as well. And if you're empathetic, that's another way of making sure that you value someone else and that you're putting yourself in their shoes and empathizing and understanding. That also helps as well.
That's awesome. That's such a good acronym.
Thank you.
Yeah, I want to like share that with everyone I know.
Oh, you can. Just make sure you let them know.
I will. Yeah, like I'll quote you, Dr. Stephanie, for sure. That's amazing. That's a really good. Because it's something so simple, but like so impactful, for sure.
Yes, yes,
Yeah.
yes, yes.
So thank you, Dr. Stephanie, so much for all of your amazing insights on this really important and emerging topic. Do you have any other like advice or information that you'd want to share before we end off?
Well, I know that, you know, me seeing a lot of this information may think that I say, oh, that it's easy. I know it's easier said than done, but this hasn't happened overnight. So it takes time for these things to correct itself. So I think doing one simple thing every day personally with yourself and in your own community, doing something every day will lead to bigger and better change. So I just say do something every day that will help make a difference.
Thank you so much. That's excellent advice. And thank you again for sharing and spending this last half hour with us. I think as pharmacists and just as healthcare providers in general, we really have to take our responsibility to help minimize barriers and improve equity in healthcare. So really hope that all of our Pharmacists Without Borders Canada members learned a lot from this webinar, because I know I certainly did. And I just want to end off by saying that if you want to learn more, please follow Dr. Stephanie on Instagram and Twitter and go to her website. Your Instagram is Dr. Stephanie Yo Mo.
Yo Mo, right. Yeah, that stands for Young Mo. So it's Dr.
Perfect.
Stephanie Yo Mo on Instagram, Facebook, and Twitter. And then also you can find me on my website, drstephanieyomo.com.
Perfect. Yeah, it's such a great resource. I use it all the time. You have such good tips just for pharmacists in general, trying to step out of traditional roles and also education, more of what we've talked about today there. So it's such a great resource.
Thank you.
I encourage everyone to check out, and also follow us at PCF Canada on our social medias for more updates. And if you're interested in ever volunteering on a global mission, please feel free to check out our website, psfcanada.org, for more info. So on behalf of Selina and I, we just want to say thank you, Dr. Stephanie, and thank you to everyone who's watching this webinar. I hope you all have a really great day.
Thank you, guys.
Thank you so much.